Magic mushrooms are a group of fungi containing psychoactive compounds, primarily psilocybin and psilocin. When consumed, these substances can induce altered states of consciousness, visual distortions, sensory changes, and altered thinking processes. Psilocybin, naturally occurring in mushrooms, converts into psilocin in the body, and both of these compounds affect the nervous system, leading to hallucinations and altered mental states. Magic mushrooms have been historically used in religious ceremonies, spiritual practices, and even recreational settings. However, the use of magic mushrooms should be approached with caution due to the potential for uncontrollable effects and risks to mental health. Many countries and regions have regulations and controls regarding the use and possession of magic mushrooms. Common types of magic mushrooms include various species from different genera. Here are some popular magic mushroom species. Psilocybe cubensis, one of the most common magic mushrooms, often found in tropical and subtropical regions. They typically grow on livestock dung. Psilocybe semilancata, also known as the Liberty Cap, this mushroom is often found in grassy fields and meadows. Psilocybe scienscens, known as the Wavy Cap, these mushrooms are often found in temperate regions, especially along coastlines. Panaeola scienscens, also called Copelandia scienscens or blue meanies, they are commonly found in tropical and subtropical regions. Psilocybe azurescens, these mushrooms grow in temperate regions and are often found along coastlines. Psilocybe biocystis, typically found in temperate regions, these mushrooms have a distinctive appearance with grooved caps. Gymnophylla species, some mushrooms in this genus also contain psilocybin and often grow on decaying wood. It's important to note that identifying and using magic mushrooms requires careful consideration and in-depth knowledge of their morphological and biological characteristics. Understanding local legal regulations is crucial when exploring this topic. Psilocybin and psilocin are two key hallucinogenic compounds found in magic mushrooms. When mushrooms containing psilocybin are consumed, it converts into psilocin in the body. Both of these compounds influence the nervous system, leading to distinct psychological and visual effects. Here are some primary effects of psilocybin and psilocin. Altered state of consciousness. Psilocybin and psilocin induce a different state of consciousness, often accompanied by an expanded awareness and perception of the surrounding world. Visual hallucinations. Users may experience unreal visual hallucinations, with images and colors undergoing distortion and appearing unusually vivid. Heightened sensation. Psilocybin can enhance sensory perception, making users more attuned and perceptive to their surrounding environment. Specialized psychological state. The psychological state often undergoes changes, including alterations in thinking processes, emotions, and a shifted sense of time. Sense of connection. Some users report an increased sense of connection with nature, society, or a deeper understanding of the meaning of life. However, it's important to note that the effects of psilocybin and psilocin can vary depending on factors such as dosage, the user's initial mood, and the environment of use. The use of magic mushrooms should be approached with caution and under the supervision of an experienced individual, as they can induce uncontrollable psychological states. There is ongoing research and experimentation to evaluate the potential medical applications of magic mushrooms, particularly in the treatment of certain mental conditions and other mental health issues. Here are some potential medical applications of magic mushrooms in the field of medicine. Reducing anxiety and depression. Some studies have suggested that the use of psilocybin, the primary compound in magic mushrooms, may help reduce feelings of anxiety and symptoms of depression in some individuals. Supporting PTSD treatment. Preliminary research has proposed that psilocybin may support in reducing symptoms of post-traumatic stress disorder, PTSD. Alleviating psychological distress. Participants in studies have reported a reduction in psychological distress and tension after consuming psilocybin. Applications in diabetes and migraine treatment. Some studies have mentioned the potential of psilocybin in reducing visual disturbances caused by migraines and improving blood sugar control in users. However, it's important to note that the use of magic mushrooms for medical purposes is still in the research phase and not widely accepted. More research and clinical trials are needed to assess the safety and effectiveness of these substances in specific medical applications. Close supervision by healthcare professionals is crucial when researching and experimenting with the use of magic mushrooms in the treatment of mental health conditions and other health issues. Identifying magic mushrooms requires attention to various morphological details and their habitat. However, this can be risky without extensive knowledge of mushrooms and ample experience. Here are some basic points to identify magic mushrooms. Check the habitat. Magic mushrooms often appear in natural environments such as fields, meadows, and areas with moist soil. Examine morphology. Magic mushrooms typically have a mushroom-like appearance with a cap and stem. Their color can vary but is often brown, green, or white. Inspect the cap. Magic mushrooms usually have moist and dense caps, sometimes with veins or a uniform texture. Examine the stem. The stem can have various colors and often features characteristic patterns or ridges. Inspect the mushroom core. When cut open, the color and structure of the mushroom core can be observed. Magic mushrooms typically have a white or brown core. Use expert guides. If unsure about identification, refer to guidebooks or seek assistance from experienced individuals. Note that identifying magic mushrooms can be risky if you lack certainty in your knowledge. If you are interested in using magic mushrooms, consult experts in the field and adhere to legal regulations. The use of magic mushrooms is not entirely safe and can sometimes pose risks to mental and physical health. Here are some considerations. Unpredictable mental effects. Magic mushrooms can induce uncontrollable psychological states, with unpredictable hallucinations and emotions. This may lead to unwanted and unsafe experiences, especially without close supervision. Risk for individuals with mental vulnerabilities. If you have existing mental health issues or vulnerabilities, using magic mushrooms may increase the risk of anxiety, depression, and exacerbate other mental health conditions. Risk for individuals with underlying medical conditions. Magic mushrooms can exert psychological stress, and for individuals with underlying conditions like heart problems, high blood pressure, or mental disorders, they may pose a sense of insecurity. Legal risks. In many countries and territories, the use and possession of magic mushrooms are illegal. Violating these laws can lead to severe legal consequences. Risk of misidentification. Incorrectly identifying magic mushrooms may lead to ingestion of toxic fungi, posing a danger to health. Before considering the use of magic mushrooms, it is crucial to thoroughly research the local legal status, consult with healthcare and mental health professionals, and ensure safe supervision during any usage. The legal status of magic mushrooms varies depending on the country and region. Here are some common legal scenarios. Legal. Some countries and territories have legalized the use and possession of magic mushrooms, often under a controlled and regulated framework. Regulations may include limits on dosage, age restrictions, and specific conditions for use. Restricted. In some places, magic mushrooms may be restricted legally, potentially legal in certain specified cases such as medical research but prohibited or controlled for recreational purposes. Illegal. In many countries, the use and possession of magic mushrooms are illegal and can result in legal consequences. Treating, selling, or sharing magic mushrooms may also be considered unlawful. Undetermined. Some places may lack specific regulations regarding magic mushrooms, creating a legal gray area with fluctuations and uncertainties. Before considering the use of magic mushrooms, it is crucial to research and understand the local legal regulations. This helps avoid legal risks and ensures compliance with local rules and regulations. Magic mushrooms, primarily containing psilocybin and psilocin, are being researched to evaluate their applications in the field of mental health. Here are some potential applications. Emotional therapy. Research suggests that the use of magic mushrooms may help reduce feelings of anxiety and symptoms of depression. Support for PTSD treatment. Preliminary studies have proposed that psilocybin may support in reducing symptoms of post-traumatic stress disorder, PTSD. Aid in addiction treatment. Some research indicates that magic mushrooms may play a role in helping individuals overcome substance addiction. Enhancement of thinking and creativity. Small studies have noted that magic mushrooms may enhance cognitive function, creativity, and philosophical thinking. Stress reduction and positive mindset shifts. Participants in studies have reported a reduction in stress and positive shifts in thinking after using magic mushrooms. However, it's important to note that research on the medical applications of magic mushrooms is still in its early stages, and more extensive clinical trials are needed to assess safety and efficacy thoroughly. Close supervision by healthcare experts is crucial when researching and experimenting with the use of magic mushrooms in the treatment of mental health conditions and other mental health issues.